Welcome to a new video, and thanks for being here today. Every man who lives long enough will face prostate issues. This is one of medicine's most well-established facts. What's far less understood, however, is that many men are living with potentially serious prostate conditions without experiencing a single noticeable symptom. By the time symptoms emerge, the opportunity for simpler interventions may have passed. Today we're discussing a critical yet often overlooked aspect of men's health: asymptomatic prostate conditions that affect the vast majority of older men. While our title uses the dramatic phrase time bomb, it's not mere sensationalism. It reflects the sudden and often unexpected ways these silent conditions can manifest after years of developing unnoticed. What makes this topic so important is the sheer prevalence of these conditions. According to comprehensive autopsy studies published in the Journal of the American Medical Association, approximately 80 to 90% of men in their 70s and 80s have some form of prostate abnormality. Whether benign prostatic hyperplasia, BPH, inflammatory changes, or microscopic cancer foci, regardless of whether they've experienced symptoms. This data is the source of our 89% figure. It represents the upper range of prevalence found in these comprehensive studies. Today, we'll examine what these silent prostate conditions are, how they develop, why they often go undetected, and most importantly, what proactive steps you can take to avoid being blindsided by them. Understanding these issues is particularly crucial because, unlike many other health conditions, prostate problems can transition from completely asymptomatic to significantly impacting quality of life very rapidly. Before we begin, it's important to note that while this information is based on scientific research, individual health needs vary significantly. The guidance shared today should complement, rather than replace, personalized advice from healthcare providers familiar with your specific situation. The aging prostate, a universal male experience. The prostate is one of the few organs in the human body that never stops growing throughout a man's lifetime. This biological reality sets the stage for the near universal development of prostate conditions as men age. The normal growth pattern research published in the British Journal of Urology International has meticulously documented how the prostate changes with age. In young adult men, 20s to 30s, the typical prostate weighs about 20 grams. By age 60, the average prostate has doubled in size to approximately 40 grams. By age 80, many men have prostates weighing 50 to 60 grams or more. This continuous growth is driven primarily by hormonal changes, particularly the shifting balance between testosterone and estrogen that occurs as men age. Unlike most growth in the body, prostate enlargement doesn't follow a linear path. It tends to accelerate after age 50, which explains why prostate conditions become exponentially more common in men over 60. Microscopic changes before symptoms. What makes the aging prostate particularly concerning is that significant cellular and structural changes often occur long before any symptoms develop. Microscopic studies from the Mayo Clinic have revealed that inflammatory cells infiltrate the prostate tissue decades before symptoms appear. Cellular architecture begins changing in the 2000s transition zone, the area surrounding the urethra, as early as age 40. Calcifications and fibrotic tissue, hardened areas that can affect urinary function, develop gradually over decades. A landmark study in the New England Journal of Medicine found that these microscopic changes can reduce the prostate's flexibility and elasticity by up to 40% before a man notices any changes in urinary function. This helps explain why symptoms sometimes appear to develop suddenly, when in reality, the underlying changes have been progressing for years. The silent progression. What's particularly important to understand is that the prostate can undergo significant changes while a man experiences absolutely no symptoms. This occurs because the prostate has considerable functional reserve capacity. The bladder can compensate for increasing urethral resistance for years. Nerve sensitivity in the lower urinary tract diminishes with age. Research from the Baltimore Longitudinal Study of Aging found that approximately 50% of men with objectively measurable urinary obstruction as determined by urodynamic testing, reported no noticeable symptoms. Their bodies were silently adapting to progressive changes until they reached a tipping point. This silent progression represents the true time bomb referenced in our title. The changes accumulate gradually and asymptomatically until reaching a threshold where the body can no longer compensate, potentially leading to the sudden onset of significant symptoms. The 3 silent prostate conditions. While most men are familiar with common prostate conditions like BPH and prostate cancer, few understand that these and other conditions often develop and progress without symptoms. Let's examine the 3 most common silent prostate issues that affect the majority of older men. 1. Silent BPH. Beyond urinary symptoms, benign prostatic hyperplasia, BPH, non-cancerous enlargement of the prostate, affects approximately 50% of men in their 50s, rising to over 80% of men in their 70s, according to the American Urological Association. What's less known is that BPH can progress significantly before causing any urinary symptoms. Research published in Urology has identified several concerning aspects of silent BPH. Bladder wall thickening occurs as the bladder works harder against increasing resistance. Detrusor muscle changes can lead to decreased bladder contractility. Upper urinary tract pressure can increase gradually, potentially affecting kidney function. A study from the Veterans Affairs Health System found that approximately 28% of men diagnosed with BPH already had evidence of bladder wall thickening and trabeculation, formation of muscular ridges, indicating the condition had been present and progressing for years before diagnosis. This silent progression explains why some men experience sudden acute urinary retention, the complete inability to urinate, as their first symptom of BPH. In cases like these, what feels like a sudden crisis has actually been developing slowly for years. 2. Asymptomatic prostatitis, the hidden inflammation. Prostatitis, inflammation of the prostate gland, is typically associated with pain, discomfort, and urinary symptoms. However, a significant form called asymptomatic inflammatory prostatitis exists and is often discovered only incidentally during evaluation for other conditions. Research published in The Prostate found that, in autopsy studies, inflammatory changes were present in approximately 75% of men over 60. Most of these men had never reported any prostate-related symptoms. The degree of inflammation did not correlate with symptom development. This silent inflammation can have long-term consequences. A study in the Journal of Urology found that chronic inflammation in the prostate was associated with larger prostate volume, faster growth rates, and higher risk of acute urinary retention, all without early warning symptoms. The inflammation appears to accelerate the growth and architectural changes within the prostate, essentially priming the gland for more rapid progression of conditions like BPH and potentially increasing the risk environment for prostate cancer development. 3. Microscopic prostate cancer, more common than realized. Perhaps the most surprising silent prostate condition is microscopic prostate cancer, small clusters of cancer cells that are present but not yet forming a detectable tumor. Autopsy studies published in Cancer Research have found these microscopic cancer foci in approximately 30% of men in their 40s, 50% of men in their 60s, up to 80% of men by age 80. The vast majority of these microscopic cancers never progress to clinical significance. However, the presence of these cancer cells represents an important aspect of prostate health that most men are unaware of, and in some cases, they can eventually develop into clinically significant cancer. What makes microscopic prostate cancer particularly challenging is that it's completely undetectable through standard screening methods like PSA testing or digital rectal examination. Even advanced imaging typically cannot visualize these microscopic changes. If you found this information valuable so far, please take a moment to subscribe to our channel for more evidence-based content on men's health. By subscribing, you'll receive updates on future videos that could provide important health insights that many men miss. Now let's explore why these conditions so often go undetected. Why these conditions go undetected. Given how common these prostate conditions are, why do they so often go undetected until they're significantly advanced? The answer involves multiple factors, from male healthcare behaviors to limitations in screening approaches. Male healthcare avoidance research consistently shows that men are less likely than women to seek preventive healthcare. A study in the American Journal of Men's Health found that only 54% of men over 50 reported having a regular physical exam in the past year. Nearly 40% of men admitted avoiding doctor visits until a problem becomes unbearable. Almost 60% of men reported they would not seek health care for urinary symptoms they considered mild. This avoidance behavior creates the perfect environment for silent prostate conditions to progress undetected, as men are not being evaluated until symptoms become intrusive, which often occurs long after the condition has already advanced significantly. Limitations of current screening approaches. Even when men do seek health care, current screening approaches have significant limitations. PSA testing can miss many cases of prostate inflammation, and early BPH digital rectal examination only assesses the posterior portion of the prostate. Urinalysis and symptom questionnaires only identify issues once they're causing detectable changes. A study in the Journal of Clinical Oncology found that standard screening methods identified only about 60% of significant prostate conditions, with the remaining 40% being discovered either incidentally during evaluation for other conditions or after progression to symptomatic stages. The variable symptom threshold. Another key factor is the highly variable threshold at which prostate conditions become symptomatic. Research in European urology found remarkable differences in when men begin experiencing symptoms. Some men with relatively modest prostate enlargement, 35 to 40 grams, experience significant symptoms. Other men with much larger prostates, 60 plus grams, report no noticeable symptoms. This variability is influenced by factors including individual differences in bladder compensation, variations in the direction of prostate growth, outward versus inward toward the urethra, differences in nerve sensitivity in the lower urinary tract, variation in pain perception, and awareness of bodily functions. These differences explain why two men of the same age with similar prostate conditions might have vastly different experiences, one struggling with significant symptoms while the other remains completely unaware of the underlying changes occurring. The sudden tipping point when silent becomes symptomatic. The transition from asymptomatic to symptomatic prostate conditions often occurs suddenly and unexpectedly. The moment when the time bomb, referenced in our title, effectively detonates. Understanding this transition point is crucial for recognizing the importance of proactive prostate health. The bladder compensation theory. Research from the Department of Urology at Northwestern University has developed the bladder compensation theory to explain the often sudden onset of urinary symptoms in men with long-standing prostate changes. According to this model, as the prostate gradually enlarges, the bladder muscle, detrusor, strengthens to push urine through the increasingly narrowed urethra. This compensation can continue for years, masking the underlying obstruction. Eventually, the bladder muscle reaches its limit and begins to decompensate. When decompensation occurs, symptoms appear rapidly and often severely. Studies using urodynamic testing have demonstrated that men can have up to 50 to 60% obstruction of normal urinary flow while experiencing minimal or no symptoms due to this bladder compensation mechanism. Once the compensation threshold is crossed, however, symptoms can develop within weeks or even days. Trigger events. Clinical research has identified several common trigger events that can suddenly transform asymptomatic prostate conditions into symptomatic ones. Respiratory infections and associated inflammation, alcohol consumption, particularly binge drinking, certain medications, especially cold medicines with decongestants, long periods of immobility, such as during travel, delayed urination, holding urine for extended periods. A study published in Urology found that approximately 40% of men experiencing their first episode of acute urinary retention reported one of these trigger events in the preceding 48 hours. The trigger event didn't cause the underlying prostate condition, but served as the final factor that pushed the system beyond its compensation threshold. The sudden impact on quality of life. When symptoms do emerge, their impact on quality of life can be profound and immediate. Research from the Veterans Affairs Health System found that men experiencing the sudden onset of significant prostate symptoms reported sleep disruption comparable to clinical insomnia, anxiety levels similar to those seen in generalized anxiety disorder, social isolation behaviors due to concerns about bathroom access, significant work productivity decreases, average 26% reduction. This dramatic impact on multiple dimensions of life explains why proactive management of prostate health, even in the absence of symptoms, is so important for maintaining quality of life as men age. Proactive detection and prevention strategies. Now that we understand the silent progression and sudden manifestation of prostate conditions, let's explore evidence-based strategies for proactive detection and prevention. Beyond basic screening, while standard PSA testing and digital rectal exams remain important, comprehensive prostate health monitoring includes additional elements. Age-appropriate baseline evaluations to establish personal prostate health metrics, tracking PSA velocity, rate of change, rather than focusing solely on absolute numbers. Assessment of post-void residual volume to detect early signs of urinary retention. Consideration of additional biomarkers like prostate health, index EHI or 4K score, for higher-risk men. Research published in the Journal of Urology found that this more comprehensive approach identified up to 28% more significant prostate conditions than standard screening alone, potentially allowing for earlier intervention. Lifestyle modifications with proven impact. Multiple longitudinal studies have identified lifestyle factors that can significantly reduce the risk and progression of prostate conditions. The most strongly supported by evidence include regular physical activity. A meta-analysis in European Urology found that men engaging in regular moderate exercise had a 25% lower risk of BPH progression compared to sedentary men. Diet modifications. Research from Harvard's health professionals. Follow-up studies showed that a diet rich in vegetables, lean proteins, and healthy fats was associated with a 33% reduction in BPH symptoms. Maintaining healthy weight. Each 5-point increase in BMI was associated with a 40% higher risk of BPH progression in a study published in JAMA Pelvic Floor Exercises. A randomized controlled trial found that regular pelvic floor exercises reduced the risk of progression to severe symptoms by approximately 40% in men with early BPH. These lifestyle approaches are particularly valuable because they can benefit men with asymptomatic prostate conditions, potentially delaying or preventing the transition to symptomatic stages. Prescription and supplement considerations. For men at higher risk, medication options supported by research include 5-alpha reductase inhibitors. These medications can reduce prostate volume by approximately 20 to 30% over 6 to 12 months, potentially addressing enlargement before it becomes symptomatic. Alpha blockers. While typically used for symptomatic BPH, some research suggests they may help maintain bladder function, even in pre-symptomatic stages. Certain plant-based supplements. Meta-analyses support modest benefits from evidence-based options like beta-sitosterol and Pygeum africanum. It's important to note that medication approaches should be discussed with healthcare providers, as they carry potential side effects and may not be appropriate for all men. The risk-benefit calculation is highly individual and depends on factors including family history, overall health status, and personal preferences. Conclusion: breaking the silence on prostate health. What makes this information so important is that awareness and proactive management can help men avoid being blindsided by suddenly symptomatic prostate conditions. While it's impossible to completely prevent age-related prostate changes, understanding the silent progression of these conditions empowers men to take control of their prostate health before problems arise. By maintaining regular health screenings, adopting evidence-based lifestyle practices, and being aware of the early warning signs that might appear, men can significantly reduce their risk of experiencing the sudden and often severe impact of previously silent prostate conditions. While the information in this video is based on scientific research, individual prostate health needs vary greatly. If you have concerns about your prostate health or are experiencing urinary symptoms, consulting with a healthcare provider who can evaluate your specific situation is the best course of action. Thank you for watching this video on this critical aspect of men's health. If you found this information valuable, please subscribe to our channel for more evidence-based content addressing important health topics. Your awareness today could help prevent significant health challenges tomorrow.